You had asked what I brought up arterial sclerosis previously when we had talked. And so what that is, it's a slow progression, and it can begin in as early as childhood. So I have a picture here of an artery. And so what it is, it's a progressive disease that can start as early as childhood. And it's of the inner lining. This is your artery. There's damage to the inner lining right there. And so what happens is that can be caused by high blood pressure, cholesterol, smoking, obesity, or can have a higher risk of it if you have a family history of having this happen, or lack of exercise or unhealthy diet. And so what happens is there's the damage, and then all of a sudden a plaque forms on that damage, and it just continues to grow and grow. And then if the plaque ruptures, then that's when a blood clot happens, and that's where it increases your risk of having a stroke or a heart attack, is because if this blocks off, that can cause a heart attack. That's where you get the chest pain. It's because you're not getting the oxygenation that you need to your heart muscle, and that's actually coronary artery disease. So the arterial sclerosis happens in the vessels, but if it is in the vessels of the heart, that's when you get coronary artery disease, because the coronary arteries are related directly to your heart. So, and then if this happens peripherally, like in your outer parts of your body, what that can do, like I said, if this breaks off, it can either go to different areas, like your brain, and cause a stroke, or it can go to your heart, cause a heart attack, or it can even go to your lungs, and that it can cause lung issues in which you just have shortness of breath and just don't feel good at all. Yes. And so that's where we get to the point of all these risk factors being, they're not exactly something that you want to happen. It's not necessarily exciting news to find out that you have coronary artery disease. And then also, so with the sleep apnea, that why they gave you the CPAP, did they ever tell you what the CPAP stands for? Or do you know?
No.
Okay. What it is, it's a continuous positive airway pressure. And so the mask that you wear is connected to the machine itself, and that's the thing that it's a high pressure blower, and that's the one that sends the airway through, and like the video showed where it keeps the constant high pressure when you breathe in and you breathe out, so it keeps your airway open so it doesn't close off. Okay. And then and so the problem that you were saying that why you don't wear it as often is because the skin breakout. And so with a lot of that, I found some information, and so some of it that says it can be related to either tightening the CPAP too much. So maybe if it's supposed to be tight fitting where it doesn't leak, but if it's tightened too much, so maybe that could be causing it. Or it could be that a different type of CPAP mask that you might need. Because do you have the full mask or just the one on your nose?
I have the full mask. They said I couldn't have the nose one because I needed the full one.
Okay. All right. So that's not an option there. And then also another one that I found is if you have oily skin, that could be causing it. Yeah. Or if there's a collection of dust, cells, bacteria, or oil. And then, so with that, you can either use a CPAP cleaner, or they say to clean it with soap and water on a regular basis. Or if it could be caused because some breakouts might not be related to just the CPAP itself, it could be possibly an allergic reaction. So if needed, they recommend either switching to a gel mask, not a silicone mask.
I don't know which one I have. I think I have the silicone.
Okay. And so that might be an option. But I also looked up some stuff. And so they have a ResMed Gecko nasal pad. And so what it is a gel pad in which you actually place it over the areas that you're breaking out, like over your nasal bridge. And what it does is it prevents skin irritation, facial sores, and can also prevent air leaks. And I looked it up, and on Amazon, it goes for about $20. And $20 at Walmart, and then $17.88 on Amazon. And then there's also a CPAP gel, and so what that is, it's like an adaptable seal. That's the one you actually put on the mask itself, and that again prevents the air leak helps with dry skin, cracked lips, and it's aloe vera based. So as long as you don't have any problems with aloe vera, that should be
I don't think so.
okay. And then that is an actual just gel that you would put on it, and that apparently is about $12 just for the gel, unless you want to do like an actual pad that will fit around it. That can be up to $25. But that could be an option, because if you didn't have any more breakouts, would you be more prone to using
probably.
it? Okay. Yeah, so those are some options that I did find. And then, yeah, I think that's all I really found out for you to cover for our educational video.